Hi friends, I am Dr. Karthikeyan. Today we are going to see a very important topic, which is prostate gland hypertrophy. Because of this prostate gland enlargement, men tend to have frequent urination at night. The frequent urination means they will get up from the bed, they will run towards the toilet. Before they reach the toilet, they will be dribbling of urine. The drops of urine will be falling to the floor before they reach the toilet pan. Once they reach the toilet pan and when they start to initiate urination, they will get stuck. The urine will not come out smoothly. It will come drop by drop and it will be highly painful and irritating. And this process happens every day night 4 to 5 times, which means it's very highly difficult and a highly irritating condition for any male. So usually this prostate gland hypertrophy happens in males above 50 years of age. So today we are going to see how this prostate gland enlarges, the urinary problem occurs, what are the treatment methods available. See, in this picture we can very clearly see that this is the urinary bladder, and the urine which is formed here, which is collected here, passes through this tube which is urethra, and this urethra is wide and dilated and it is passing easily through this gland which is called the prostate gland, which is located here. But in some situation like here where there is prostate gland hypertrophy, the gland has become enlarged. Because of this enlargement, the urine which is formed here is not able to pass through freely because of the narrowed urethra here in prostate. So this is called prostatic hypertrophy. It usually comes in men aged above 50 years. There is another condition called prostatitis, which is infection of the prostate gland, which can be easily cured by giving antibiotics. But there is another condition called prostatic carcinoma. Prostatic carcinoma is one condition where we can wait and watch, because this is one of the rare cancer where we can wait and watch, because there is a high chance that this cancer prostate will not grow and it will remain as such till death. Only very rarely this prostatic cancer cells, they grow into proper cancer forming cells affecting all tissues. So we can follow a wait and watch policy, especially for prostate cancer. But in today's video, we are mainly going to concentrate on this benign prostatic hypertrophy, where there are some foods and there are some lifestyle changes which can really reduce the prostate size and bring back the person back to normal. Only if these measures fail, then we have to go for medicines and treatment, surgical modalities, which we will see one by one today. So now we will see how to reduce this size, how to reduce this prostate gland size. So there are certain measures. The first and most important thing is reducing the weight, because weight plays a major role in development of prostatic gland hypertrophy. So if we try to reduce this weight by doing exercises, this alone, the reduction of obesity, overweight alone will contribute to reduction in size of the prostate. Second most important thing is foods. There are certain foods which are very beneficial for prostate. So what are those foods? Asian mushrooms are a class of mushrooms which are widely used and widely available. So consumption of these Asian mushrooms helps to reduce the size of prostate. Then pomegranate. Pomegranate is a very good fruit and its juice is very helpful in reducing the size of prostate. Consumption of nuts, all nuts, almonds, pistachios, all nuts will lead to reduction in the size of prostate. And there is certain fruits called avocado. These avocado fruits also can lead to reduction in size of prostate. But there is another most important thing which we have to avoid in foods. What is that food? That is coffee, tea. So what is the problem? There is a substance called caffeine in coffee. This caffeine, what this caffeine does to the bladder is, it actually, the caffeine products has to be metabolized and then it passes out through the urine. So when it goes down, this caffeine actually irritates the prostate gland, prostate tissues, leading to enlargement of the prostate tissues, leading to obstruction of the urethra. So avoiding caffeine tea will lead to reduction in the size of prostate. And the last but not least, the most important thing here is stress. So what stress does to our prostate? Actually, there are certain muscles which are surrounding the prostate. So what happens to these muscles under tension and under stress? These muscles are always in contracted state. When a muscle is in contracted state, what happens? It gives pressure on the prostate. Because of the pressure on the prostate, this prostate tube gets narrowed. Because of this narrowing, there is difficulty in passing urine. So once you release stress by meditation or yoga, this meditation and yoga will lead to reduction in the stress reduction in tension and reduction in the tension in these muscles. These muscles relax. Once these muscles relax, the prostate gets relaxed and the urethra gets dilated again and there will be smooth flow of urine. So for treatment of prostatic hypertrophy, you can follow all these techniques starting from weight reduction to the footsteps which I told you to stress reduction. If you are not able to control with these measures, then we have to go to doctor. So next step is to go to the doctor. What the doctor will do is he will insert his hand through your rectum, through the anus, and then he will try to feel the prostate. Suppose if the prostate is enlarged, it will be felt through the rectum because it is the rectum and the prostate is situated very close to rectum. When it is enlarged, it can be easily felt through rectal examination. In addition to rectal examination, ultrasound examination also will tell you the exact size of the prostate. So once there is prostatic hypertrophy, the next step is to test for what is the type of swelling it is, whether it is a normal benign swelling or it is a carcinoma. So for that, the tissue will be taken from the prostate again through the rectal route. Once you collect the tissues, it will be sent for pathological examination, and in the pathological examination, suppose if it comes as carcinoma, the treatment is different. Suppose if it comes as normal benign prostate hypertrophy, the treatment is medicines. The medicines could be alpha blockers. See, the alpha blockers, what it will do is it will relax the muscles surrounding the prostate. Once the muscles surrounding the prostate is relaxed, the urethra gets dilated, there will be smooth passage of urine. There is another class of medicines called 5-alpha reductase. So this 5-alpha reductase finasteride medicine, what it will do is it will lead to reduction in the secretion of a hormone called dihydrotestosterone. When there is a reduced testosterone in the body, it will lead to reduction in the size of the prostate, which in turn will lead to dilatation of urethra and smooth passage of urine through the urethra. So these two medicines will be tried. In addition, some antibiotics will be tried. Suppose if there is prostatitis, there is infection of the prostate, so the antibiotics can cure that also. So these are the medicines which will be tried for some time, for quite some time. Mostly this benign hypertrophy may reduce, the patient may get symptomatic relief. But even after this medical treatment, even after all those measures which I told you in the beginning, nothing works out, then we will go for surgery. The surgical method usually involves transurethral approach. Through the transurethral approach, the surgeon will approach the prostate. He will try to reduce the hypertrophy and he will try to re-establish the urethral dilatation. That is the surgery which will be done. Usually with this surgical approach, the patient will get symptomatic relief for quite some time. Suppose if it is a carcinoma, the treatment is entirely different, because for carcinoma it is usually chemotherapy, radiotherapy and a complete resection of prostate and the surrounding tissues which are already infiltrated with cancer cells, that also will be removed. So that will be the surgical treatment for prostate. So these are the measures. So these are the treatment measures for prostatic hypertrophy. So there are many people who doesn't know what is a prostate, how it gets inflamed, how it gets hypertrophied, and what are the treatment measures available. So kindly please share this video with all your friends and relatives to spread the awareness about this prostatic hypertrophy and the treatment methods available. If you like this video, press the like button below, and if you have not yet subscribed my channel Dr. Karthikeyan, please subscribe my channel and press the bell icon to receive the updates. Meet you all in the next video. Until then, goodbye from Dr. Karthikeyan. Thank you.